So as time goes by, we're all aging, and the population as a whole is aging, and the incidence of non-Hodgkin lymphoma increases in the elderly. So actually a very common clinical scenario now is the presentation of a new patient who's elderly, over 70 or even over 80 years of age, with a new diagnosis of diffuse large B-cell lymphoma. That's our commonest non-Hodgkin lymphoma subtype. And it can be a real challenge actually giving potentially curative chemotherapy in that age group, because as we age, we tolerate chemotherapy less well for a variety of reasons. And my colleague Dr. Eyre and myself were part of a very big multi-center retrospective data collection exercise, and we presented the data in over 600 patients looking at intended dose intensity in patients over 70 years of age. What do we mean by that? Well, 100% intended dose intensity is standard dose R-CHOP, and reduced dose intensity typically would be R-mini-CHOP, where we reduce the doses of cyclophosphamide and doxorubicin. And it was the doses of those two drugs in particular that we captured in this exercise. Now, the interesting thing was that in the overall cohort, so that's 70 years and above, an intended dose intensity of 100% was associated with better outcomes than a reduced intended dose intensity. That's perhaps not surprising, because those who get 100% dose usually are a bit fitter as well, so their outcomes are likely to be greater. But the surprise and the interesting thing here was that in the over 80 age group, actually even using an intended dose intensity of around 50%, which is the R-mini-CHOP doses, actually the outcomes were the same. So even though overall it's good practice to maintain dose intensity, in the over 80s, actually the toxicity of the chemotherapy starts to impact on outcomes. And actually that's led to a change in practice in our unit, and I think a change in practice in other units too, where if we have a patient over 80, we're much more likely to give a reduced dose R-CHOP, R-mini-CHOP, at the outset, because actually it doesn't really matter how fit an 80, 82, 84-year-old patient is. You know, their creatinine clearance is reduced, their bone marrow reserve is less, so they're more likely to develop febrile neutropenia, and we have to be very careful not to do more harm than good with our chemotherapy. So I think it was a really good example whereby we can now tailor chemotherapy intensity according to age and fitness.